Ooh, taking a live look outside of Galveston. They're on the beach. A few beachgoers out there on this hot Monday. And of course, listen to this. Skin cancer is the most common cancer in the U.S. with more than 5 million cases diagnosed each year.
Shocking numbers there. You might be surprised by all the different places on your body skin cancer can be found. So grab a partner. Check your skin. Board-certified dermatologist Sherry Ingraham is here to show us how it's done, along with her lovely models Jennifer and Brooke, who we'll get to in just a moment. But this, I think, is a critical thing because we all hear about sunscreen, and we're going to talk about that later on in the show. But we're talking about skin checks. What should we be looking for? How do we know when there's a problem?
The most important thing you can do is check yourself, check a loved one, check your partner once a year. So you want to look for the A, B, C, D's, and E's. So A is asymmetry, so spots that were round but became irregular. B is border, if the border becomes jagged or heart-shaped or any irregular shape. C is color, if the color becomes varied. If it was brown, it became red, blue, white. D is diameter, so if it starts small and then it gets a little bigger, and then E is evolution. That's the most important. If it was flat and became raised, if it was flat and became scaly, if it was raised and started bleeding, any kind of evolution, watch for that.
Got it. Any changes?
Any changes.
And of course, as we said, skin cancer is the most common cancer in the U.S. The other thing, it's preventable.
It's preventable. That's what's so amazing. I mean, we get to look at our skin every day. You can't look at your liver or your kidneys, but you can look at your skin. So it's an opportunity to take charge of your own health.
Now, we're looking at some pretty gnarly photos right now, Dr. Ingraham. We saw one on an ear. That's the bottom of someone's foot, right?
Absolutely. And the scary thing about acral melanomas on the feet is they get discovered late. And the key to skin cancer, especially melanoma, is early detection. The earlier it is detected, the less likely it's spread to other areas or metastasize. And it has an incredible 5-year survival rate if caught early.
And is there skin cancer risk increase as you age?
Yes. So what's interesting is with women, most melanomas are more common in women before 50. After 50, it's more common in men. The median age of detection of melanoma is 63 years old and more common in men. But remember, most of the sun damage that we get that causes skin cancer later in life is before you're even 18 years old. So you need to start as young as possible, and remember, it's a lifetime of protection.
Absolutely.
All right, so when it comes to these partner skin checks, Dr. Ingraham, you say get naked, find a partner, and check each other out.
Absolutely. So I tell people what's interesting is men and women very different where we see melanomas. So in women, melanomas are more common on the arms and legs.
Okay.
And why is that? Well, we wear shorts and skirts more often, right? And we have our trunk covered. So in women, it's more common to see them in these areas. So what we do during exams or at home, you want to look for spots that are irregular. This is a dermatoscope that dermatologists use in the office. So what I'm looking for is the border irregular. Is the color varied? If the patient told me, for example, you know, I've always had this spot and suddenly it changed.
It just looks different.
It looks different. Also, moles are normal in children. A 7-year-old, for example, may have 7 moles. An 8-year-old, 8 moles. It's normal to acquire nevi up until you're about 30 to 40. If you're getting new moles after that age that are truly moles, we need to look at them. That is suspicious.
Okay. And what about sort of those uncommon spots that we need to keep a look at?
So, you know, in men, we're more commonly looking at like the chest, the back. These are spots that men tend to have melanomas. Also men, head and neck. But what's interesting is, if you'll have a seat, I'll show you, in men and in women, we need to think about areas that the sun doesn't shine, because melanoma is by and large a genetic disease. If you have a first-degree relative with a history of melanoma, you have a much higher incidence. So you also want to look at places the sun doesn't shine. So look at the feet, look between the toes, and look at the nails. Subungual melanomas can be deadly. So if you see a dark streak in your nail, a bruise that doesn't heal, or if it even looks like you had a subungual hemorrhage or a bleeding under the nail, but it doesn't grow out or heal, that can be suspicious. Very common areas also, head and neck in men and on the scalp. I always tell people, wives save lives. Have your wife, have your spouse, your loved one, your partner, look at your body, look in your scalp, but also tell your hairdresser, because it's not uncommon to find melanomas and skin cancers. I found them in the scalps of patients. We find them in the ears, behind the ears, and men commonly on the back of the neck is the spot. I've also seen them in the nostrils and in the genital area. So look at yourself, but then grab a partner, grab a loved one, make a night of romance, and have them look at your back in the areas that you just can't see.
Make a night of romance.
A night of romance
does not sound romantic,
with
Dr.
the
Ingraham.
thing.
Okay.
But it is true.
So let's say someone does find something suspicious. What next?
The next thing you do is call a board-certified dermatologist and get a skin check. If you have a family history of melanoma, you should automatically be checking yourself regularly. But if you found a spot you're concerned, call your dermatologist. And the take-home message is, don't not make that appointment because you're scared, right? You've seen a spot. I do have patients who go, you know, I don't want to know. You want to know because the earlier it's caught, it will save your life. It is a preventable disease if caught early.
You want to know. That's great advice. Dr. Ingraham, Jennifer Brooke, thank you so much. By the way,
you.
Dr. Ingraham, as we mentioned, she is going to stick around with us because later on in the show, she is sharing tips on helping us choose the right sun protection.
Oh, yeah, it's good for the whole family. Coming up next,